Welcome to Public Health Matters, the show that addresses public health issues that matter the most to the citizens of Harford County. Real issues, real people, and the information you need to know.
Hello, I'm Molly Mraz, Public Information Officer for the Harford County Health Department, and your host for today's Public Health Matters, the show that takes a closer look at the public health issues that matter the most to the citizens of Harford County. The past year, with the world in the middle of a pandemic, has been lonely and challenging to say the least. We have made great strides in public health to help fight COVID-19, including the development of the COVID-19 vaccine. We are here today, masked up, 6 feet apart, to talk about the COVID-19 vaccine, COVID-19, and the health disparities that have unfortunately shown their faces in our community. Joining me here today are Dr. David Bashai, Harford County Health Officer, and Dr. John Sampson, Associate Professor at Johns Hopkins University. Thank you so much for being here today, and welcome to our show. Dr. Bashai, you, as your new role as Health Officer, can you just give a brief background story about yourself?
Sure. I joined the health department at the beginning of January after 24 years on the faculty at the Johns Hopkins School of Public Health. I went to medical school, trained in internal medicine and pediatrics. I'm working once a week in the emergency room over at St. Joseph's, and I have a PhD in economics, and so most of the work I've done over the last 24 years has been on the economics of public health and public health departments. So I decided last year that with COVID-19 epidemic, this would be the time to really get my hands dirty, roll up my sleeves, and go to work helping an American county fight against COVID-19. I feel really fortunate to be in this particular health department because of all of the great people, and the people in the county have been so wonderful in helping us fight this disease.
We are happy to have you with us today, and for the past month, it's been wonderful to have you here as our health officer in Harford County, so welcome. Dr. Sampson, welcome. Can you give a little bit of history on yourself?
Okay. I'm originally from California, but actually after I finished training in anesthesiology and critical care medicine, I first came to Harford County 25 years ago to start the critical care service at Harford Memorial Hospital. Since then, I've worked at Walter Reed Army Medical Center, and then eventually came to Johns Hopkins University, mostly to focus more on not only patient care, but also on education of young physicians, and also on working for education and collaboration with international partners, because international medicine is one of my focuses.
Okay, we'll talk about that in just a second. But can you talk about briefly, Dr. Bashai, we'll start with you, what your role has been with the COVID-19 pandemic?
So as the health officer, I'm responsible for making sure our behaviors are as good as they can be as citizens of the county, making sure we have social distancing, using masks, making sure people that are running businesses follow the rules. So we have that important behavioral education aspect. We're also vaccinating. The Harford County Health Department is one of the most important sites to get vaccine while it's still in shortage. As time goes on, more venues will offer vaccines. It'll be available at doctors' offices and pharmacies, and then the health department will focus on disparities, on making sure we reach everybody, because private sector won't do that. The health department is watching now. We're publishing our coverage rates by race and ethnicity, and trying to help our vaccine providers reach out, get people informed, and give them opportunities to get this COVID vaccine.
Thank you. Dr. Sampson?
Yes, so I have several roles in terms of what I do for COVID patients. And in terms of providing critical care medicine, we actually manage patients from the point of where they come from the emergency room into the intensive care unit, and then hopefully manage them till they can recover. And sometimes there are patients who can't recover, and then we make sure that they're comfortable at least for that period of time. For anesthesiology, I manage COVID patients in the operating room. We actually have at Johns Hopkins a special COVID operating rooms where we concentrate most of them at. I also am very active in the obstetric ward, so I take care of laboring COVID patients. I take care of patients who need anesthesia for C-sections who have COVID, and then the final thing is as part of the airway team at Johns Hopkins. There are times where I'm responsible for basically managing all of the patients that need to be intubated anywhere in the institution, and then we have a team that goes and puts them on the ventilator, puts their breathing tube in and puts them on the ventilator so that the medical teams can continue care with them.
So Dr. Bashai, your role is to make sure that they don't get to Dr. Sampson, right?
Right.
Like you don't want your community to get to where Dr. Sampson is. Although we appreciate you, we don't want to see you, right? So you briefly talked about health disparities. You just touched upon that. Can you talk about what that means, Dr. Bashai? What is health disparity, and why is that relevant right now during the COVID-19 pandemic?
Yeah, so people are different, and in every society there are breaks between the haves and the have-nots, and part of what we do in public health is to make the have-nots get better and reach out to them, find the obstacles that are stopping them from getting the health, because health is something that belongs to everybody, and it shouldn't be just the luck of how you're treated that makes you healthy. We can break down the barriers. We just have to find them, observe them, and work together to make health belong to everybody.
And you both you've done a lot of work, Dr. Sampson in Africa and Dr. Bashai in the Middle East and Africa. Dr. Sampson, will you just briefly talk about your work in Africa and how your role there really helped public health in general?
So a lot of the work that we do in Africa is focused on health system strengthening. We started out doing medical missions, but really now it's mostly we're looking at the health system and how to strengthen it in collaboration often with the Ministry of Health in a particular country we're working with. And one of the projects we did, fortunately, just a few years ago, was training doctors in West Africa in specific areas that were more underserved, on how to use mechanical ventilation in concert with their countries purchasing mechanical ventilators. Well, it turns out that the equipment and personnel that we used to physically train those people came in handy because the countries contacted us at the beginning of the pandemic in April and March to let us know that, look, we're purchasing more of this equipment. Can you help us to train our people how to use this? Of course, we understand that you can't come. Can you figure out a way to do it online, virtually? And so we were able to use the simulation equipment that we had accumulated already in those countries and use it online to link ourselves with the people who we had also trained over there to facilitate training people throughout the particular countries we were working with.
Wow. Like, I never know what day it is, and you're doing all that work over in Africa. That's amazing. That's amazing work. What about you, Dr. Bashai, about your work in the Middle East and Africa, your public health work?
Yeah, so part of the disparities in every society are how you're treated. We just finished helping the government of Dubai that had opened up health insurance for everybody. And sure enough, you cannot work in the city of Dubai without a health insurance card. But we showed that wasn't enough. And just access to health insurance isn't enough to give you access to a doctor. In a city like Dubai, you might know that about 80% of the people are not citizens. They're visiting from low and middle income countries, from India and Pakistan. We found that those people, they were insured, but they were not having doctors that they could see. So there was still a health disparity. It wasn't enough to give somebody a card if they don't have a way to actually get to the doctor. And we gave that advice to the city health officials in Dubai so that they could actually get the job done. Because they want people to be healthy, to build the buildings and run their economy, and it's just not enough. So detecting a health disparity is the first step towards getting the political will to ending it, which is what we're here doing in Harford County. We're detecting the disparities in COVID-19 vaccine, putting them out, and then working together to say, how can we address these disparities in COVID-19?
And so what are you seeing? Where's the health disparity here with the COVID-19 vaccine?
Well, I wanted Dr. Sampson to answer part of that, but we know that COVID is much, much more serious disease if you have pre-existing conditions. And that's where we have disparities. We went into this pandemic with disparities in who was laboring under chronic conditions. And our minority populations have had more diabetes, obesity, heart disease, hypertension, and so they're more vulnerable to COVID. So that's part of what we have to address right now.
So why, Dr. Sampson, why do the minority groups have more health disparities?
They have health disparities. Sometimes, in some cases, there can be genetic reasons in certain cases, but in the majority of cases, it's a matter of access to health care that have been historical phenomena that's happened over many years. And which continue to happen right now. There are recent studies that have just come out this year showing that women who have an African-American women who have an African-American obstetric and gynecologist have better C-section survival rates. There are studies showing that people who get admitted to an intensive care unit with sepsis are less likely to survive that experience if they're from a minority group. And so we have a number of things, the disparities that we see across society, which only during my lifetime have been gradually decreasing, still are also present in the healthcare sector, are present within the healthcare institutions, within the populace, and so those things affect people's health status and survivability. And so until we've resolved those things, then we're going to continue to see those problems.
And so how do you resolve those things?
So one of the ways you resolve it, which is one of the ways that I am working with people at Johns Hopkins with, is to try and actually encourage the development of more African American physicians and nurses by reaching out to people at the high school level, at the college level, connecting. And so because a lot of those disparities also relate to the number of African American healthcare providers. You know, at most of our institutions, you find that there are very few African American specialists, very few anesthesiologists and critical care physicians, for example, across our institutions. And so that's one of the ways to resolve it. Another way is to identify what are the problems that are not being identified, or is it a problem of pain not being addressed? That's one of the problems that we've seen. Is it a problem of making certain assumptions about a community versus another community, or feeling like like there's a tendency, maybe subconscious, to provide more of certain things for one community versus another? So that's why there are a number of people across the country who study these healthcare disparities and try to figure out ways of ameliorating them.
So the COVID-19 vaccine has been a hot topic over the past couple weeks, and we've just touched the surface about the health disparities with the vaccine. But in order for us to kind of reach those and help reach those populations is communicating, which is what we're doing here today. But answering some questions that people really might not know the answers to, but might not feel comfortable asking and may not know where to look. So can you just talk about the safety of the vaccine? Dr. Bashai, we'll start with you. The safety of the vaccine and why you would encourage people to get the vaccine.
So safety is so much more important for vaccines than for almost any other product, because we give vaccines to healthy people. All pharmaceutical products have to be safe, but when you're giving something to somebody who's already healthy, you have to make absolutely sure that you're not going to make them worse. So the way we learned about the safety of these products had to do with the numbers of trials. Right now we have the Moderna vaccine and the Pfizer vaccine. Each of these had to go through a randomized controlled phase 3 trial. The Pfizer vaccine had 40,000 people in it, 20,000 got a placebo, 20,000 got the vaccine, 30,000 in the Moderna trial. And each vaccine recipient was watched. They had to fill out a daily list of whatever symptoms they had, and most of the symptoms were in the very first few days. We know exactly what those profiles were. They were published, and most of them were small annoyances. The most common one was a sore arm. People get sore arms from shots. Some got the feeling like they were fatigued, like they were having not themselves. They did not get runny noses or coughs like getting the flu. They were just feeling their immune system was revved up. Some got a fever. The side effects mostly were gone within a few days. We've been looking for these other things. We've seen no evidence of Guillain-Barré. We've been following these vaccine recipients now for as long as 4 to 5 months. Not any long-term side effects in each of these, and we're still watching. Each of these vaccine recipients in the trials is being followed on a regular basis, and now that the citizens are being vaccinated, there's a vaccine adverse event reporting system. So if anybody is feeling an adverse event, the FDA is waiting and watching to see if there are long-term side effects. And I'm watching too as the health officer, because it's my name on the line that's promoting this vaccine.
Right.
So if we see that there's something serious out there, we need to go back. There is a condition called anaphylaxis, which is one of the most serious types of an allergic reaction that can be seen. People who have already had anaphylaxis in the past are a little bit more likely to get anaphylaxis from this vaccine. The rates are small though. The rates are about 1 out of every 100,000 cases is going to get anaphylaxis. We treat anaphylaxis effectively with an EpiPen, and we have EpiPens at every one of the vaccine sites. So far in Harford County, we've not had anaphylaxis, but at 1 in 100,000, it could happen, and we'll respond to it, and we're done with anaphylaxis. The advantage is, the immunity to COVID is so much more life-saving than these side effects that are really pretty rare, and most of the ones that aren't rare are gone in just a few days. And we're watching, but it doesn't seem to be a situation where we're going to see some surprises this time.
So we did a search. I'm sorry, did you have anything you wanted to add?
The only thing I'll add is that somewhere around 10% of the people who were studied were also African Americans, and it was identified as, the vaccine was identified as safe and effective in the African American populations as well. There are apprehensions that we'll probably talk about later that African Americans may have in terms of vaccinations or any type of a medical therapy that seems as if it's being sort of like imposed upon them. But these studies should help to allay those fears. In addition to that, again, just like Dr. Bashai was saying, we have all of the additional data from all of the people who've more recently gotten vaccinated.
You can talk about it now if you'd like to go into with the African American population and the vaccine.
Okay, so basically, the more information comes out, publicly available, information about what's happened in the past, the more we find out things that at the African American community also always suspected, that oftentimes in the past that we've been victims of medical research for the good of the advancement of medical care. And there are books like one called Medical Apartheid, which chronicle that advances in OBGYN, research related to the Tuskegee Institute, not just the Tuskegee syphilis study, I should say, and also the research related to Henrietta Lacks, which was where cells were taken from her at Johns Hopkins and used for research all over the world for research advances. And so we have a lot of apprehension and suspicion about anything that comes out for good reason. And but the fact that this studies have been done, including African American populations, and have not shown any worse outcome, have shown equal effectiveness, I think should help to allay those fears. And the fact of the matter is that we have a higher, we've been affected more by death rates and infection rates from the COVID disease anyways. And so that will also help to hopefully encourage people in our community to consider getting vaccinated to protect themselves from suffering from COVID.
So how would you suggest that we as public health professionals, can reach out to those communities to encourage them to get the vaccine? Like, what are we not doing because we're not reaching these communities? So how can we improve our messaging?
We need to continue some of the things that we are doing. I think that over time we already have seen that there is increased willingness to accept considering the vaccine among African American populations. There was a recent Fox poll that actually documented that there was increased acceptance among African Americans for the COVID vaccine. We need to continue outreaches to different segments of the community, realizing that our community is not a monolith. Our community has urban areas, we have rural areas, we have young people, we have older people, we have people from different socioeconomic classes. And so different approaches and different outreaches have to be made for each of the different segments of the African American community, as well as the other minority communities, which have also been more effective. The Latinos have been more effective, the Native Americans have been more effective. And I think that similar outreaches will also help with their apprehensions regarding the vaccine.
We surveyed Harford County before we received the vaccine to try and gauge how many people were interested in getting the vaccine. And it was interesting. It was the responses were majority of the recipients were white, or the people who took the survey, they were white females ages 25 to 34. And so that kind of was telling in the sense of, who is our audience. We really wanted to include the minority populations, and we had a hard time reaching them for this survey. And so, but some of the feedback we received was really interesting because people were apprehensive to receive the vaccine because they did not feel that the vaccine had been tested on enough people like them, meaning their race, whether they were pregnant, whether they were breastfeeding, their age, things like that. Can you talk about, one of the things is they were concerned it would change their DNA. And so, Dr. Bashai, would you just briefly talk about that?
Yeah, so many people are confused by this because they hear the word messenger RNA, and these two vaccines are messenger RNA vaccines. Let me tell you what messenger RNA is. Messenger RNA is made by everybody's body. Even trees make messenger RNA. It is made in order to give a task order to produce proteins. So we make messenger RNA to tell our body, make that protein. The vaccine contains a little note to my body. It says, Dr. Bashai, we want you to make this protein. The messenger RNA is conformed so it cannot get into the nucleus of my cell. It cannot weave itself into my genetic code. It's blocked by the nucleus of my cells. It can't get in, could never get in, can't possibly get into the nucleus. Moreover, the message that it has is destroyed. I mean, if you get a task order, you do the task and you get rid of it, like a pizza shop. Make a pepperoni pizza, you make the pepperoni pizza, you throw away the order form. That's what my cells are doing with this vaccine. I made the spike protein, which is about to create the immunity that I need. My cells make the spike protein, they put it on my muscle cells, they show it to my immune system, and they shred up the messenger RNA within a few days. So I got the vaccine 10 days ago. I am confident that not a bit of that messenger RNA is in me, and not a bit of it went into my cells and changed my genetic code. So that's why I'm not worried that I'm going to get a long-term side effect from this product. It's not in me anymore. As a doctor, I worry about long-term side effects from medicines that stay in our fat cells, that weave themselves into the body and can be seen in the body for years. DDT, famous pesticide, it gets into your body and stays there for years, long-term side effects. Not this vaccine. Every cell in my body has shredders, enzymes that digest it and tear it up within hours, which is why we have to put it in an ultra-cold freezer. It's an unstable molecule that falls apart if we don't take good care of it. So we hold it together long enough to get it into the body, and then the body shreds it. It cannot get into you and be part of your long-term composition of your body.
Sorry, go ahead.
I'd like to just elaborate on the polling thing that you mentioned.
Yes.
So there's two aspects of that. Number one is the issue about the vaccine being rushed.
Yes.
Now, during the summer, there were a lot of messaging that was coming on the news from White House sources, basically saying that the companies were being mandated that they must finish their testing before the end of October. And at that point, I myself received a polling, and I was like, if there's a mandates that the science has to be, that the vaccine has to be released at this time, regardless of the science, I'm not sure I'm going to take that vaccine. I think now we've passed all of that up. The election's over. All of the pressure in terms of those timelines, that whole issue is gone. And the vaccine companies, even Pfizer, actually didn't receive the same money, actually, even from the government in terms of their creation of a vaccine. So I think polling now, that same polling is going to have different results. Now, in terms of your inability or your challenge, the challenges that you had for reaching the African American community, let's say in Harford County, that should be a warning sign that that same challenge would result in your ability to outreach the African American community. And so the lesson can be taken from analyzing why that challenge occurred. Were all of the African American organizations, churches, fraternities, sororities, Masonic organizations, community organizations, were all of those agencies, were all of those organizations outreached in terms of reaching them? Because if you go through those organizations, those established networks within the African American community, you'll get a lot of polling results, at least.
And we've learned that throughout this process. And so it's been, I appreciate your insight with that for sure. We actually are out of time. Can you believe it's been 30 minutes already? I think we will definitely have to do a part 2 session on this because we've only hit the tip of the iceberg, right? So that is all the time we have for today. I would like to thank my guests on today's show, Dr. Bashai and Dr. Sampson. If you would like more information on COVID-19 and the vaccine, please refer to our resource page after this program and join us next time for another important health issue that matters the most to the citizens of Harford County. Thanks for watching.
You've been watching Public Health Matters, brought to you as a public service by Harford Cable Network, your county connection.